Hello, everyone. Bonjour à tous. Welcome, and thank you for participating in today's technical briefing, which will provide an update on the COVID-19 situation in Canada, as well as an update on the vaccine rollout in Canada. Bienvenue au briefage technique qui donnera une mise à jour sur la situation de la COVID-19 au pays ainsi qu'une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. Today, we will hear remarks from Dr. Theresa Tam, Dr. Howard Njoo, and Brigadier-General Krista Brodie from the Public Health Agency of Canada. They will be accompanied by Joelle Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions du Dr. Theresa Tam, Dr. Howard Njoo et Brigadier-Général Krista Brodie de l'Agence de la santé publique du Canada. Ils seront accompagnés de Joelle Paquette de Services publics et Approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Alors procédons. Let's begin. Over to you, Dr. Tam.
Merci et bonjour à toutes et à tous. I wish to take a moment to acknowledge the recent discovery of unmarked graves at the site of a former residential school in Saskatchewan. I'm deeply saddened by the news this week and extend my thoughts to the Coasset First Nation as they grieve, as well as with everyone impacted by the residential school legacy. I encourage Indigenous peoples to reach out if you need support, such as through the Hope for Wellness or National Indian Residential School Crisis Lines.
Bonjour à toutes et à tous. Comme Dr. Tam, je souhaite prendre un moment pour reconnaître la découverte des tombes non marquées sur le site d'un ancien pensionnat en Saskatchewan. Je suis profondément attristé par les nouvelles de cette semaine et j'adresse mes pensées à la Première Nation de Coasset dans son deuil, ainsi qu'à toutes les personnes touchées par l'héritage des pensionnats. J'encourage les Autochtones à faire appel au soutien dont vous avez besoin, notamment par l'entremise des lignes d'écoute téléphonique Hope for Wellness ou National Indian Residential School.
Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Over the past 2 months, we've made significant progress in bringing COVID-19 disease activity down and raising vaccination coverage up. Although the Delta variant of concern has emerged as the latest hurdle, Canada has every opportunity to avoid a strong Delta wave by remaining vigilant to keep infection rates low as we build the vaccination barrier wall high.
Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et de modélisation effectués au pays qui orientent la gestion continue de la COVID-19 au Canada. Au cours des 2 derniers mois, nous avons fait des progrès considérables pour ce qui est de réduire l'activité de la COVID-19 et d'augmenter la couverture vaccinale. Bien qu'un nouvel obstacle se soit présenté sous la forme du variant préoccupant Delta, le Canada peut faire ce qu'il faut pour éviter une forte vague Delta. Il nous suffit de demeurer vigilants afin de maintenir les taux d'infection bas pendant que nous élevons haute la barrière vaccinale. You're mute.
So slide 1. The strong and steady declines in disease trends has continued over many weeks. Average case counts have dropped by over 90% since the peak of the third wave in mid-April, with just over 750 new cases being reported daily over the past 7 days. The number of people experiencing severe and critical illness is also significantly lower since overall infection rates have declined. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has dropped by almost 75% since peak activity to about 1,100 daily. Of these, on average, 530 were being treated in intensive care units, and there were an average of 18 deaths reported daily.
Diapositive 2. Les taux d'infection de la COVID-19 ont atteint un sommet dans la plupart des régions, suivi d'une baisse plus lente de la moyenne quotidienne des taux d'occupation des hôpitaux. Toutefois, dans les régions où les taux d'infection baissent, mais sont encore élevés, comme au Manitoba, l'occupation des lits d'hôpitaux n'a commencé à diminuer que récemment. Avec une durée moyenne de séjour de près de 2 semaines pour les personnes hospitalisées en raison de la COVID-19 ou de près de 3 semaines pour les personnes gravement malades, le nombre de patients hospitalisés s'accumule au fil du temps, prolongeant la pression exercée sur les services de santé.
Slide 3. Hospitalizations have declined and stayed relatively low for seniors aged 80 years or older who were prioritized for vaccination from mid-December. Among all other adult age groups, hospitalizations and ICU admissions rose and were higher with increasing age during the third wave, as infection rates fell and vaccination rates increased among younger adults aged 20 to 59 years. A slower but steady decline in hospitalizations has been seen.
Diapositive 4. À l'échelle nationale, la tendance de RT demeure inférieure à 1 depuis la mi-avril, ce qui signifie que l'épidémie est demeurée hors d'un schéma de croissance dans la plupart des régions du Canada.
Slide 5. Canada continues to monitor for variants of concern using genetic sequencing, with over 30,000 or 18% of all reported cases sequenced in May. As case numbers fall, many areas are moving to sequence 100% of COVID-19 cases to maintain awareness of existing and emerging variants across the country. 4 variants of concern have been detected in Canada, and while the Alpha variant continues to account for most cases, the Delta variant has increased more than 4-fold since late April, percent faster than the Alpha variant. While we must remain vigilant, especially for variants with reduced impact of vaccines, a complete 2-dose series of COVID-19 vaccines provides substantial protection against variants of concern, including the Delta variant. Importantly, achieving high vaccination coverage across the adult population is expected to significantly reduce the severity profile of COVID-19 going forward.
Diapositive 6. Plus de 34 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada depuis le début de la vaccination à la mi-décembre. On estime que 76% de la population admissible âgée de 12 ans ou plus a reçu au moins une dose de vaccin contre la COVID-19. Grâce à la récente accélération de l'administration de la deuxième dose, 26% de la population admissible est maintenant entièrement vaccinés. En particulier, les communautés autochtones et les territoires qui ont lancé leur programme de vaccination de manière prioritaire atteignent ou sont sur le point d'atteindre les taux de couverture vaccinale maximaux, notamment pour les deuxièmes doses. Dans les territoires, de 71% à 85% de la population de 12 ans et plus a reçu au moins une dose et de 55% à 74% sont entièrement vaccinés.
Slide 7. Across the age groups, we are continuing to see encouraging levels of vaccine uptake. At least 1 dose and fully vaccinated coverage is highest at over 94% and 64% respectively for seniors 80 years or older who were prioritized during the earliest weeks of the vaccination rollout. With the expansion of vaccine programs, coverage has increased stepwise across the younger age groups, helping to elevate Canada to the top 10% of countries with the highest per capita number of vaccine doses given worldwide. But even the modest targets we've set for a safer reopening are not the ultimate goal. They are stepping stones in Canada going for gold in vaccine coverage. It's important to get as many people fully vaccinated as possible to provide strong protection against symptomatic disease, severe illness, and emerging variants of concern, including the Delta variant. Keeping the momentum up during the last stretch, will require targeted approaches to understand the factors that support vaccination and to remove barriers to vaccine uptake. This is where community-based programs excel. By understanding the needs of local populations and finding solutions to bring vaccinations where people are at, we can build a strong wall of vaccine protection, one community at a time.
Diapositive 8. Parmi les millions de doses de vaccins administrées, on a signalé assez peu de cas de COVID-19 chez les personnes ayant reçu au moins une dose de vaccin contre la COVID-19 et encore moins de cas chez celles ayant reçu 2 doses. N'oubliez pas que les vaccins mettent un certain temps à agir, soit jusqu'à 14 jours après la première dose pour assurer une bonne protection et jusqu'à 14 jours après la deuxième dose pour assurer une forte protection. Selon les données fournies par les 10 provinces et territoires, jusqu'au 12 juin, seulement 0,14% des personnes partiellement vaccinées ont été infectées 14 jours ou plus après la première dose, alors que seulement 0,08% des personnes complètement vaccinées ont été infectées 7 jours ou plus après la deuxième dose. Comparativement aux cas non vaccinés, ces personnes étaient plus susceptibles de ne signaler aucun symptôme et moins susceptibles de souffrir d'une maladie grave nécessitant une hospitalisation. Ces résultats concordent avec les études sur l'efficacité des vaccins qui attestent une forte protection contre la maladie grave.
Slide 9. Based on Canadian data up to June 19th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to July 4th. The graph on the left shows the predicted number of cases could be in the range of 1,413,010 to 1,420,740 by July 4th. The graph on the right shows the predicted number of deaths could be in the range of 26,175 to 26,475 by July 4th.
Diapositive 10. Ces prévisions actualisées à plus long terme montrent comment la trajectoire de l'épidémie pourrait évoluer jusqu'au début d'août, compte tenu des effets des variants préoccupants, y compris du variant Delta et de la vaccination. Dans l'ensemble, les prévisions suggèrent qu'à l'échelle nationale, nous nous attendons à ce que les cas continuent de régresser selon la trajectoire de la ligne grise. Selon les taux actuels de vaccination, alors que de nombreuses juridictions commencent à assouplir les mesures de santé publique, la bonne nouvelle est que nous pouvons encore nous attendre à la baisse des cas selon la trajectoire de la ligne bleue. Toutefois, la trajectoire de la ligne orange montre qu'avec les taux de vaccination actuels et en tenant compte de la transmissibilité accrue du variant Delta, une recrudescence est toujours possible si la réouverture augmente de 50% les taux de contact quotidiens entre personnes dans la communauté. Bien que les prévisions soient encourageantes, elles confirment la nécessité d'adopter une approche prudente de l'assouplissement des mesures sanitaires et de demeurer vigilant quant aux signes de recrudescence et de continuer à augmenter la couverture vaccinale.
Slide 11. The experiences of other countries emphasize the need for continued caution as vaccine coverage increases. As well, easing of measures must be controlled, gradual, and responsive to potential shifts in disease activity until infection rates decline to low and manageable levels. For example, the United Kingdom slowly and cautiously relaxed measures as infection rates declined and vaccine coverage expanded, yet experienced a recent resurgence fueled by the emergence and spread of the Delta variant in younger, largely unvaccinated people. Although the Delta variant is now predominating in the UK, fortunately, hospitalization and fatality rates have not risen as sharply as infection rates to date. Nevertheless, in response to rapidly rising cases, the UK rapidly implemented measures, including increased testing, enhanced contact tracing, and targeted vaccination in affected communities to control the spread of the Delta variant. Most recently, the UK postponed the final stage of reopening by 4 weeks in order to buy more time to further increase first and second dose coverage. International experience with the Delta variant highlights the importance of attaining high vaccine coverage while remaining responsive to signals of increased disease activity, even once infection rates are brought to low levels.
Diapositive 12. Une modélisation plus complexe continue de nous aider à comprendre comment différents facteurs tels que le déploiement de vaccins, les niveaux de couverture vaccinale et les variants préoccupants pourraient avoir un impact sur différents scénarios de levée des mesures de santé publique. Nous mettons régulièrement à jour ces scénarios à mesure que des nouvelles données et preuves apparaissent. Lors de notre dernière présentation, nous avons montré un scénario dans lequel l'épidémie resterait vraisemblablement maîtrisée si les mesures restrictives n'étaient assouplies qu'après que 75% des personnes de 12 ans ou plus auraient reçu une dose et qu'au moins 20% auraient reçu 2 doses. C'est la première ligne verticale en pointillé bleu. Dans le même scénario, à gauche sur la diapositive, les précautions individuelles ne seraient levées qu'après la vaccination complète de 75% de la population âgée de 12 ans ou plus. C'est la deuxième ligne verticale en pointillé bleu. Ainsi, le nouveau scénario de droite examine l'impact potentiel du variant Delta qui est plus contagieux et plus grave. Ce scénario de modélisation montre que si le variant Delta est prédominant lorsque les restrictions sont assouplies au moment où les objectifs initiaux de couverture vaccinale sont atteints, nous risquons d'assister à une recrudescence plus forte que prévu cet automne ou cet hiver. Il est important de noter que ce scénario montre également qu'il existe un risque d'une recrudescence plus forte en train de dépassement de la capacité des hôpitaux. C'est la ligne horizontale en pointillé rouge cet automne ou cet hiver.
Slide 13. While the new scenario on the previous slide shows the Delta variant has the potential to cause a stronger resurgence this fall or winter, the scenario on this slide shows that increased vaccine uptake can help to counteract the potential impact. This scenario shows what could happen if Delta is predominating, but we have achieved a higher vaccine coverage, with at least 80% of the population aged 12 to 54 years fully vaccinated before we ease individual precautions such as masking and spacing. In this scenario, while we may still expect some degree of resurgence this fall or winter, by maintaining individual precautions until vaccine coverage is a bit higher, we could reduce the risk of a strong resurgence that could overwhelm hospital capacity. Fortunately, we are continuing to see good vaccine uptake across Canada, with first dose coverage already over 76% and second dose coverage ranging from 21 to 64% in adults 50 years or older. However, this modeling underscores that vaccination among younger adults can have a big impact. Given their increased work and social connections, younger adults naturally have higher rates of in-person contact. So the higher the vaccine coverage among these age groups, the greater the overall impact on epidemic control. With the emergence and spread of the Delta variant, it is more important than ever for as many people as possible to get fully vaccinated across Canada. Getting fully vaccinated improves your own protection against symptomatic infection and severe illness. It provides better protection against more severe variants of concern, including the Delta variant, and protects those around you by building a wall of vaccination protection across the community.
Diapositive 14. Nous avons fait ce qu'il fallait pour avoir une meilleure été et, en demeurant vigilants pour que le nombre de cas reste bas, nous pouvons demeurer sur la voie d'un automne et d'un hiver plus sûr. L'augmentation du nombre de première et de deuxième doses administrées renforcera le mur de protection vaccinale contre la COVID-19, y compris le variant Delta. Il ne faut pas faire les choses à moitié. Il faut 2 doses de vaccin contre la COVID-19 pour se protéger d'une forme grave de la COVID-19, conférer une meilleure protection contre les variants préoccupants qui sont plus contagieux et plus graves et bâtir une forte immunité dans la population pour maîtriser la COVID-19 en l'absence de restrictions. Les nouvelles orientations et les outils d'évaluation des risques individuels peuvent nous aider à prendre avec assurance des décisions éclairées pour profiter de l'été en toute sécurité. La situation continue d'évoluer et n'est pas la même partout. Il est donc important de continuer à suivre les conseils des autorités locales de la santé publique. Votre santé et votre statut vaccinal ainsi que ceux de votre famille sont importants. Être COVID avisé vous aidera à maximiser vos protections en vous faisant entièrement vacciner et en respectant les mesures de précaution fiables, notamment le port de masque et la distanciation. Réduire les risques au minimum par le choix des mesures de protection adaptées au degré de risque des différentes sorties et activités. Merci, thank you, Megwetch, et Go Habs Go.
Well, slide 14, and as Dr. Njoo has just said, we've done the work for a better summer, and by staying vigilant to keep cases low, we can stay on track for a safer fall and winter. Increasing the first and second doses will build a stronger wall of vaccination protection against COVID-19, including the Delta variant. Halfway is not okay. 2 doses of COVID-19 vaccine are needed to protect ourselves from severe illness due to COVID-19, to give better protection against more contagious and severe variants of concern, to build strong immunity across the population to keep COVID-19 under control without restrictions. New guidance and individual risk assessment tools can assist us in making informed and confident decisions to enjoy the summer safer. The situation continues to evolve and things are not the same everywhere, so it is important to continue following local public health advice. The health and vaccination status of you and your family matters. Be COVID-wise and aware, and we'll help you to maximize your protections by getting fully vaccinated and keeping up with trusted precautions, including masking and spacing. And minimize your risk by going out safely in different risk settings and activities. So thank you, merci, Megwitch, and as Dr. Njoo said, go Habs, go. Thank you. And I am now going to pass the parole Brigadier-General Krista Brodie.
The second quarter is drawing to a close. We have delivered almost 43 million doses of COVID-19 vaccines across Canada. By the middle of next week, we expect to have 50 million doses available for Canadians. That represents enough vaccine supply to fully immunize 75% of the eligible population. We will continue to work with manufacturers to ensure Canadians have the vaccines needed in the right quantity and at the right time and place to maximize immunization efforts. Even in the midst of the big lift, with large-scale shipments arriving on a regular basis, fluctuations in the distribution plan can be expected. We are working to minimize the impact of last-minute changes and to accelerate the availability of doses to the greatest extent possible. While operational factors of this nature come with a big lift, we have delivered more than 3 million doses of Moderna to the provinces this week, in addition to the 2.4 million doses of Pfizer-BioNTech. Yesterday, we received a shipment from AstraZeneca totaling 795,000 doses to be managed at the federal level, allowing provinces to draw the precise quantity of doses required to support their second dose strategies and unique requirements. Next week, the final week of the second quarter, we are expecting to bring in 2.4 million doses of Pfizer-BioNTech, and 1.4 million doses of Moderna. Pfizer-BioNTech shipments for the first 2 weeks of July were announced last week. We expect 900,000 doses during the week of July 5th and 1.4 million doses the week of July 12th. Earlier this week, we received confirmation of the remaining July allocations of 3.1 million doses for the week of 19 July and 3.7 million doses for the last week of July, signaling the complete July Pfizer-BioNTech allocation of 9.1 million doses. We are working closely with the provinces to manage inventory of available vaccines as we draw closer to an optimal supply of the COVID-19 vaccines needed to fully immunize eligible Canadians in the greatest possible number. Le deuxième trimestre tire à sa fin. Nous avons livré près de 43 millions de doses de vaccins contre le COVID-19 dans l'ensemble du Canada. D'ici le milieu de la semaine prochaine, nous prévoyons avoir 50 millions de doses à offrir à la population canadienne. Cela représente une quantité suffisante pour vacciner pleinement 75% de la population admissible. Nous continuons de travailler avec les fabricants pour que la population canadienne dispose des vaccins requis en quantité nécessaire, au bon endroit et en bon moment pour optimiser les efforts de vaccination. Même en plein milieu de la grande poussée, avec l'arrivée de grands envois, les fluctuations continuent de se produire au niveau de la planification. Nous travaillons pour réduire au minimum l'impact des changements aux dernières minutes et pour accélérer l'offre de doses autant que possible. Malgré des facteurs opérationnels de ce genre dans le contexte de la grande poussée, nous avons livré plus de 3 millions de doses de Moderna aux provinces cette semaine et plus de 2,4 millions de doses de Pfizer-BioNTech. Hier, nous avons reçu une livraison d'AstraZeneca, totalisant 795 000 doses à gérer au niveau fédéral, permettant aux provinces de prélever la quantité précise de doses qui leur est nécessaire pour soutenir leur stratégie de deuxième dose. La semaine prochaine, qui est la dernière semaine du deuxième trimestre, nous nous attendons à recevoir 2,4 millions de doses de Pfizer-BioNTech et 1,4 million de doses de Moderna. Les livraisons de Pfizer-BioNTech pour les 2 premières semaines de juillet ont été annoncées la semaine dernière. Nous nous attendons à distribuer 900 000 doses durant la semaine du 5 juillet et 1,4 million de doses la semaine du 12 juillet. Plus tôt, cette semaine, nous avons reçu la confirmation des allocations restantes de juillet. 3,1 millions de doses pour la semaine du 19 juillet et 3,7 millions de doses pour la dernière semaine de juillet. Le total est en 9,1 millions de doses de Pfizer-BioNTech pour le mois. Nous collaborons étroitement avec les provinces pour gérer l'inventaire des vaccins offerts alors que nous nous rapprochons d'un approvisionnement optimal pour pleinement vacciner le plus grand nombre possible des Canadiens et des Canadiennes. Merci.
We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, Roxane.
Merci, thank you. Please press star 1 at this time to ask a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour toute question. The first question is from Abigail Beeman from Global News. Please go ahead.
Thanks for taking my question. I want to start in terms of Canadians getting their first doses. It seems that percentage is dropping, or the number of Canadians getting their first dose is dropping. Why, and what risk does that pose, especially keeping the Delta variant in mind?
Yes, it's Theresa Tam. I'll start with the answer to that question. So in the presentation that we provided, there's some breakdowns in terms of what's happening in each province and territory, but also what's happening in each age group. So for sure, we're seeing very good vaccine uptake in the older age groups, and that's great. So the 50 years and older are getting past that 75% mark. And they're also accelerating with the second doses because they were some of the first groups that got vaccinated. I think, as I've said in the presentation, it's really the younger adults. I think that deserves a concerted effort. Partly it is because they were later to start. So I do expect them to accelerate. And I think part of this presentation is to encourage them to do so because it does make a difference. They are the highest transmitters because they have an increased social mixing. So that is really important, is the younger adults. And now we also have the vaccine for the 12 to 17-year-olds as well. And we've actually seen a pretty rapid uptake in that age group. So that's encouraging. So I think partly it's just a matter of time. And I want to see us going past the 75% mark and shoot for as close to that 100% as possible. But what I am very encouraged is that of course, the highest risk, the older population, is getting past those milestones. But with the Delta variant, I think our bottom line is that we just need to get as high as possible, as much as we can pass that 75% goalpost for both first and second doses. We do know that second dose is quite important in terms of strengthening your protection against that type of variant. But we also indicated, I think in my update, that more targeted approaches are needed. So the group that is not vaccinated as yet is a varied, heterogeneous group. And there's no one size fits all, which is why a community-based approach using trusted voices, using different techniques to reach the unvaccinated is really important. So we've provided some funding at the federal level in terms of the Immunization Partnership Fund and the Community Innovation Fund in order to stimulate that. You've also seen provinces pulling out all stops from lotteries to other incentives, also in order to reach some of these groups.
Thank you. And for my follow-up, in terms of those people who won't get vaccinated or who aren't getting vaccinated, can you speak to what life will look like? Will society normalize with a certain level of COVID at some point? What will that look like?
Yes, so I've just been updated that the tools that we talked about at the end of our presentation provide some of the guidance for individual risk assessment. And of course, there's a population level consideration as well. So with as high a vaccine coverage as we can achieve, we may be able to achieve a level of community protection that allows us to protect those who are not yet vaccinated because, for example, there are certain medical conditions or because they are older and their immune system doesn't work as well or you're immunosuppressed. It's really important that we do our best to maximize protection to protect those who can't get vaccinated. And of course, kids under the age of 12 don't yet have a vaccine. So with all of that in mind, I mean, one would expect still some circulation of COVID-19, but we want to be able to get that suppressed to the lowest level possible prior to the fall-winter season. So that's really important. And so I think careful reopening is important. So that will help keep virus levels low and enables everyone to be able to do more. What you will see in some of the tools, there's a suite of different ones. One is a tool that we supported from Horizon University, and that is a collaboration with the National Institute on Aging, but is adapting a previous tool that they have in terms of looking at a risk calculator. So you can look at your risk based on whether you're fully vaccinated, you've had one dose, or you haven't had any vaccine. What does that risk look like, and how can you reduce that risk going forwards? And we've just put up some guidance on life after vaccination on our website, so I'll get people to check it out, which means that some people may still need to protect themselves against circulating virus if they haven't been vaccinated. But if you are vaccinated, you get the really incredible protection that vaccine affords. Then you can do more without a mask and physical distancing. The bottom line, though, is all of my chief medical officer of health colleagues have said, please make sure everyone knows to listen to local public health, because the situation is different in every province. So I think what is looking like is the summer is looking pretty good. And what I'm watching for is what happens when each of the individual provinces reopen. And that would tell us whether we might get some sort of resurgence. But if the vaccination rates go up as high as possible, I think all of that can be manageable. The next planning, if you like, is moving then towards the fall. But I hope some of these tools will be helpful to everyone.
It's Dr. Njoo. Maybe the only thing I would add to what Dr. Tam said with her very comprehensive answer is that, we have been getting these questions about, why don't we have guidance that's so straightforward and simple? Like, for example, the CDC in the U.S., yes, with 2 doses of vaccine, I can take off my mask. So I think I would just point to the Ryerson tool. It's a good, I think, a way of being informed and looking at and maybe thinking about all of the factors that people at an individual level need to consider before they do certain activities or interact with others, be it family, friends, etc. So I think it's worth your while to take a look at it, and I think hopefully it's educational as well, and you can use it for maybe a planned activity. But then as you do other activities in the summer, I think it just gives you some pause to actually carefully go through that personal risk assessment. Thank you.
Thank you, Dr. Njoo and Dr. Tam. Next question. Prochaine question.
Thank you. The next question is from Marika Walsh from the Globe and Mail. Please go ahead.
Good afternoon. Following up on that, I think I'm a bit confused about what you guys are saying. Dr. Njoo, did you just say that you are in favor of people following the CDC guidelines? You said, yes, you can take a mask off if you're fully vaccinated. So it's very unclear to me, what is the actual guidance you're giving? You're pointing people to an online calculator that, when I tested out, says that even when I'm fully vaccinated and the people I'm meeting with are fully vaccinated, our risk is moderate. Then you're pointing to this life after COVID chart that has been out since May and is about a population level advice. So specifically, what can people do who are fully vaccinated right now? Can I go hug my mom, or are you saying, no, do not break your bubble?
Okay, so thank you for the question, Marika. Maybe I'll answer because it was directed to me. I'm sure Dr. Tam will have something to say. So I apologize if you misunderstood. No, I think what you and others have been pointing to in terms of, for example, the CDC guidance, it makes it seem straightforward. Yes, I have my 2 vaccines. I can do whatever I want. And we're saying, no, it's much more nuanced than that. And you can see by the tools that there's also a level of what I would call your personal sort of a risk assessment and risk tolerance. There's lots of factors in play. It's not as simple as what your status is with respect to your vaccination. It's also obviously understanding what the epidemiology is in your local community, and that's obviously, I think, reflected by the point we always make that follow the guidance of your local public health authorities, because they know best what's going on. Is the virus really circulating at a level that there's a potential risk in terms of transmission that might have an impact on the healthcare system and so on? But with respect to whether you can hug your grandparents and so on, if you look at the tool and do it in detail, it takes into account things such as what are the potential sort of underlying medical conditions, let's say, of your grandparents or others that you may wish to interact with, and a whole host of other factors such as, indoors, outdoors. So I think I would just say that take a look at it. Hopefully Canadians will take advantage and recognize that that there's lots more than just saying a simple yes, no, what you can do with 2 vaccines. So I'm not sure if Dr. Tam may has something more to add. Thank you.
Yes, and the Life After Vaccination page now should have 2 additional sections, and that adds to the community aspects of protection, but also now has what does being vaccinated mean for you, so as an individual. It'll have an infographic. I haven't actually seen it myself. Since it's been up there, it should have red, yellow, and green bits that tells you some rules of thumb. So if you're fully vaccinated, for example, and you're outdoors with a small group of fully vaccinated people, by all means, consider taking your mask and no need to physical distance. But then if you're with a crowded, large crowd in a large house party, you have no idea who is vaccinated in or not, then consider following the measures that are put together by the organizers. If you yourself have an underlying medical condition, and you're not sure if you're, even with 2 doses, you're well protected because you're immunosuppressed, then consider wearing a mask and maintain that physical distancing, or not attending if you don't feel comfortable. So I think some of the nuances are provided, but perhaps you were looking at a not quite updated website, so please check it out.
Thank you. I am on the website right now, and there is no update, so it would have been helpful to receive that in advance of this technical briefing with the other materials. I think that what I'm confused about, and what many other people are confused about, is why the advice from your organization is, for example, you just said, if you're fully vaccinated and you're outside, you can take your mask off with a group. People have been unmasked, gathering outside for months now. That has been the point. We've been told that that is what's safe. So why does it seem that your advice for fully vaccinated has not at all moved the needle on what can be done when there is a marked difference between being fully vaccinated and not at all vaccinated?
Yeah, you have to, sorry that this tool wasn't provided to you, but it's hot off the press. So you can ask us more questions the next round. But it will show you there's a gradation, and really being fully vaccinated affords you a huge amount of protection. That is absolutely true. So you can go into some of these settings that are indoors with a much better sense that you are protected. But what I'm saying is that if you have an underlying medical condition, you may want to think about layering on more protection. But even unvaccinated people can go outdoors without a mask if there's no real active, with vaccinated people. So so the tool will go through all of that. And then if you're indoors with fully vaccinated people, you're having dinner, you're watching whatever, that's fine too. Take off your mask and don't have physical distancing. So it goes through all of that as well. So it's not just the outside. It does provide the fact that you can reduce some of those personal protections indoors.
It's Dr. Njoo. I guess, Marika, you're also commenting on, while this has been going on for months or so on, I think, as we said in our presentation, look what's happening now with the spread of the Delta variant, and also the experience in other countries. Look at the UK, where they've had a good vaccination program, they've had high vaccination rates. They had a planned sort of opening, right, loosening of public health measures, and they've pushed that back as the Delta variant has sort of obviously become more predominant. And look at another country such as Israel, where they were maybe letting go in terms of the use of masks, and now they're putting in more restrictive measures. So I think all these experiences in other countries also inform us here in Canada as a sort of cautionary tales. And I think the advice we're putting out now, obviously, that's in many ways complementary to what obviously local and provincial public health authorities are doing, are all meant to inform and help Canadians in terms of the risk assessment, what they can do. But I would say, hey, the science keeps evolving. We'll have to keep an eye on the variants, and certainly learn from other countries as well as we move forward. Thank you.
Merci.
Prochaine question. Next question, please.
Thank you. Merci. The next question is from Rebecca Keenan from Savimont. Please go ahead.
Hi. Yes, I was wondering, what should parents know about the myocarditis risk in teens that has been linked to the COVID vaccinations internationally?
Yes, thank you for that question. And we've been following the situation very closely and linking with the CDC, our European counterparts, as well as the regulator, Health Canada, linking with other regulators to monitor and understand the analysis on that, on the myocarditis or inflammation of the heart. So you may have seen some of the communications out of the United States. Personally, I was actually quite reassured by what they are saying, in that what they have observed is this is rare. It does occur in younger populations. It's primarily seen after the second dose, but it is mild. And in overall, that individuals will sometimes don't need any major treatment. They will get better on their own, or there are treatments, of course, and anti-inflammatory medications that can be provided, and so they don't get very sick. And so that is reassuring, and it's still seen more in males. But I think the bottom line is that the global literature provide us with that kind of reassurance. And so the National Advisory Committee on Immunization is actively reviewing all of this together with Health Canada, and we expect some updates from them. But the initial analysis is from the United States, is that they've determined that the benefits far outweighs the risks. At the moment in Canada, we've been monitoring through our vaccine safety surveillance systems, and we've been monitoring these cases all along, and we don't see any specific signals of concern. And in fact, the rates of myocarditis in the vaccinated population is lower than what we would normally expect in a regular year. Having said that, we haven't had a lot of people who are younger, who've had 2 doses. You've seen the graph that we presented. So we do need to monitor this carefully. And of course, inform parents, inform the youth of the kind of symptoms to look for, which is if you do get chest pain, you're feeling unwell, you don't know what's going on, shortness of breath. Sometimes in certain circumstances, your heart rate might be irregular. And under all of those circumstances, please seek medical help. But again, based on the data, these are generally mild illnesses, and that occur very quickly soon after the second dose, and they all seem to resolve in general. And so there are a few cases that are hospitalized, but again, I think what I would suggest is we will wait and see what the revise is next week, but the international data is reassuring.
I wonder, is there any way for parents or teens to mitigate the risk? Like if you're an active athletic teen, should you take it easy for a few days after your second dose, for example?
That's a good question. I think see how your body feels. And I know even with adults, everyone reacts a bit differently. And I would say always schedule your vaccination when you can take some rest afterwards. I think that applies to everyone, including younger people, and take it easy. Don't schedule stuff that's going to take a lot out of you for a few days after your second dose, and watch. Don't think of yourself as invincible. Just watch and see if you got any symptoms, and then tell your parents and go and see the doctor.
Thank you. Next question. Prochaine question.
Thank you. Merci. Once again, please press star one at this time to ask a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 maintenant pour poser une question. And our next question is from David Thurton from CBC News. Please go ahead.
Hi, yes. I just wanted to follow up about the questions about myocarditis and also just kind of extend it to pericarditis as well. So the question that I have is, on Wednesday, the CDC released a sweeping overview of these conditions in young people with a possible link to, of course, the mRNA vaccines. One of the big takeaways was that the FDA was going to add a warning to the product information. So is Health Canada considering the same thing?
Yeah, all of this is under consideration, and we will hear more quite soon, I think next week, both from Health Canada and from the National Advisory Committee on Immunization. To just remind people, of course, we are learning from the international experience because we haven't had that many younger population that's had 2 doses. So they need time to quickly examine that international information coming out of the United States and other countries.
Okay, and just this other question comes from a viewer through our Ask CBCT. And just as we're mixing vaccines, some people are getting AstraZeneca and an mRNA vaccine. The viewer wants to know, is it true that mixing doses may not count as a completed series outside of Canada, even though they are widely permitted within Canada? So if you travel abroad and you have 2 different vaccines, well, this viewer wants to know, does this count as being fully vaccinated?
So in the Canadian context, you would be, and these are authorized vaccines in Canada. I think the international landscape is evolving as we speak. Most countries are looking at this right now. Some countries, such as, I believe, France, for example, and others might take that into account. Many European countries actually have gone to mix those schedules. So I think those are the most likely countries that are going to accept that. But if the global landscape is actually quite complicated, each country has authorized different vaccines. We're also looking towards the WHO in terms of what they have authorized as well. And so I think the really key thing, as I've said, for the next while, please just check the country that you're going to see what the evolving rules are, because it is difficult to give you a rule of thumb. Of course, we will be speaking with international counterparts and indicating to them that this is an acceptable schedule for us, and encourage them to look at it in the same way, given the information that we know about how effective these vaccines are. But I can't give you the answer in certainty. Please do check.
Thank you. La prochaine question sera la dernière. The next question will be the last. Thank you.
Thank you. Our last question is from Stephanie Taylor from the Canadian Press. Please go ahead.
Hi, thank you so much for taking my question. By a voice coming out with a one-size-fits-all approach of what those who are fully vaccinated can do, what those who are partially vaccinated can do to get at the nuance, isn't there a risk that people will simply be left confused, overwhelmed? If they can't find these tools on the website, they just won't pay attention to them and they could get it wrong?
It's Theresa Tam. I'll answer that question. First of all, do check out your local public health. 2 is that I think there's some very simple rules of thumb, which is if you're fully vaccinated, you can be quite reassured based on the variants and assessments against the currently circulating variants that you're going to be quite well protected, and that you can consider not masking or physical distancing under many different conditions. Where you do have to think twice is, of course, indoors, crowded, multiple people with unknown vaccination status, then you have to sort of look at your own personal conditions as to whether you can accept that kind of risk. And so that's the general thumb. But outside is always better than inside. The 3 C's, just remember that still applies. Don't go out if you're sick, and all of those things I think people have learned. They've learned some really tough things over the last year and a half now, really. They've learned to adapt. They've really learned some of the basic foundational principles, and those are going to stand people in good stead. And then what you're doing is adding on top of that a significant layer of protection that vaccines are going to afford. And so I think that's just the bottom line. So the tool itself, I think what is the most evident is that if you're fully vaccinated, there's a lot that you can do now with a lowered risk.
Thank you. I guess, why not just come out and say that in a public way and provide some kind of national guidelines? Like, what is so wrong, or what is the risk that your organization sees if it does that? Because there does seem to be hesitancy to provide some kind of national guidelines on what fully vaccinated people can do. So I'm just confused as to what you think might happen if you were to come out and do something like that.
Yes, and we apologize that the tools were not ready, but we are expecting that guidance to be up on our website either now or very soon after this news conference. So we will provide that. But my colleagues, the other chief medical officers, said, look, we've already got some rules in our own province, and we want to make sure people follow that because we have our own set of contexts and situations. So I think that we've given people a rule of thumb, and that they should also then check in with their local jurisdiction. And you will see that, I mean, some of the top line messages that we have provided in terms of what people can do is that, it's things like you can now consider getting close to people without wearing a mask, taking into account the who you're meeting and the setting. You now don't have to quarantine after traveling. So that is being communicated for travel across the border now. You don't not necessarily need to quarantine after being exposed to another person with COVID-19. Now that you do have to follow the local public health advice, but that's as to the rule of thumb as well. So that is expected to be on our website, and please do check it out. And we apologize, this wasn't there before the presser started.
Thank you, Dr. Tam. That will be all for today's technical briefing. C'est ce qui met fin au briefing technique pour aujourd'hui. Any additional questions can be directed to Media Relations at the Public Health Agency of Canada. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci beaucoup et bonne fin de journée.